preparing for medical and dental school interviews. This topic tends to elicit stress for many students, but the good news is that we know what schools generally look for in students they interview, and we know what you can expect in your interviews to a certain extent. So today I'm going to share that insight with you to help decrease some of the pressure you feel and improve your performance in medical and dental school interviews. Anytime you're invited to an interview, you deserve a congratulations. Schools typically only interview students who have demonstrated that they are academically qualified for their program. So if and when you receive an interview invitation, know that it indicates that the admissions committee was impressed by your application and use that knowledge to boost your confidence. Now that the school has determined that you meet their academic requirements, they want to talk with you in person to determine if you have the qualities they consider important. Such qualities include effective communication skills, maturity, self-motivation, enthusiasm, cultural competence, program fit, integrity, and compassion. Interviewers will be looking for concrete evidence of these characteristics, so think about specific examples of times when you embodied each of these criteria before the big day. It is also crucial that you take the following 4 steps before your interview. First, learn about the school. This will demonstrate that you are a serious and enthusiastic candidate. It will also help guide the way you prepare and present yourself in the interview and allow you to figure out whether the program is a good fit for you. Some ways to learn about the school include reviewing the program website, reading through any materials you received, and networking with current and past students. Second, stay informed on bioethics issues and current events in healthcare. You are not expected to be an expert, but you should have some general knowledge about significant topics in the field. Regularly reading the health and science section of a major national newspaper is a good way to stay informed. Third, know yourself. This will help you get ready to talk about yourself and your accomplishments in the interview. Refamiliarize yourself with your application materials and take stock of your academic and clinical experiences, involvement in clubs and organizations, and major accomplishments. Lastly, prepare and practice. This will increase your confidence and improve your performance on the day of the interview. And I will talk more about how to do this on the following slides. An important part of preparing and practicing is being aware of the type of interview you will encounter. If your interview invitation doesn't include that information, simply ask. Most schools are open about it. Interviews for medical and dental school typically take on one of the following forms. The first is an open interview. In this type of interview, the interviewer, usually a faculty member, admissions representative, or alum of the school, will have looked over your application materials beforehand. This means that she or he will have insight into what you bring to the table and may ask questions that explore elements of your application in greater detail. Another type of interview is a closed interview. With this format, the interviewer will not have looked through your application materials, so she or he won't be coming in with any preconceived notions about who you are as a student. There is also something called a semi-open interview, which is when the interviewer only has access to part of your application. This typically means that she or he will have seen your personal statement but not your transcript. Medical and dental school interviews may also be in panel format, meaning that there will be multiple interviewers. They may be in a group format as well, meaning that you will interview alongside several other interviewees. The multiple mini-interview, or MMI, is also commonly utilized. This involves a rotation through a 2-hour circuit of 8 to 10 10-minute mini-interview stations, similar to objective structured clinical examinations in med school. This type of interview is used to assess non-cognitive characteristics, such as critical thinking and ethical decision-making skills, as well as creativity and knowledge of the healthcare system. Another common type of interview is the standardized patient encounter. With this format, an actor plays the role of a patient and simulates some sort of medical situation. You do not need to have medical knowledge for this kind of situation. You should also be aware that you might have to complete an online pre-interview assessment called the CASPER. This assessment consists of a series of hypothetical situations presented in video format, followed by open-ended questions that require brief written responses on how you would react or behave in those scenarios. Once you know the type of interview you will encounter, it's time to start practicing interview questions. On the screen is a list of some of the most frequently asked questions that fall under the category of a traditional interview. These types of questions are used to get a general sense of who you are as a person and a prospective student. The first one, tell me about yourself, is very common. So you can be fairly certain that this, or some form of this, will be the first prompt you receive in your interview. When answering it, try to provide an overview of who you are by drawing on your educational, extracurricular, and clinical experiences. Also make it concise. Say about 4 to 5 bullet points about yourself. The following 4 questions are very commonly asked as well. Why do you want to be a doctor? Why this program? Where do you see yourself in 5 or 10 years? And what is your greatest strength and weakness? Taking the necessary steps to prepare before an interview will help you formulate responses to these. I also want to briefly mention that when answering the weakness question, the key is to describe what you're doing to work on the particular weakness you provide. In other words, the weakness itself isn't as important as the strides you are making toward improving it. You should practice responding to behavioral interview questions as well. These types of questions are based on the idea that your past behavior will predict your future performance. So they require that you provide examples of specific times when you were in certain professional situations. Some of the most commonly asked about situations include a time when you dealt with a difficult team member, a time you encountered a moral or ethical dilemma, a time when you built a relationship with someone who was different from you, and a time you solved a problem. The STAR method is a technique that will help you organize your thoughts and construct coherent responses to these behavioral interview questions. STAR stands for situation, task, action, and result. So you begin your response by providing an overview of the situation and the context of the story. You then explain the task you had to complete in that situation. After that, describe the action you took to complete that task and conclude with the result of your actions. Hypothetical questions are a third question type you will likely encounter in your interviews. These require that you analyze a hypothetical scenario and describe how you would handle it. There are no right answers to these questions, but the interviewer will be looking for evidence of critical thinking, problem solving, and ethical decision-making skills in your responses. Some examples of hypothetical questions include, what would you do if you were seeing a patient in the emergency room and she or he wanted to leave against medical advice? How would you react if a colleague wanted you to keep a medical error a secret from a patient? And what do you think about physician-assisted suicide and alternative medicine? So at this point in the presentation, you may be feeling overwhelmed. These interviews significantly impact the admissions committee's decisions, and preparing for them will require quite a bit of work on your part. Although there is no getting around the fact that this is a difficult process, there are some ways that you can reduce the stress you may be feeling. Therapeutic breathing is one way to manage your interview anxiety. This involves inhaling through your nose for a count of 5 and exhaling through your mouth for a count of 6. When you breathe in, you should fill your stomach with air. So if you placed one hand on your chest and one on your stomach, you should only feel your stomach expanding, not your chest. The superhero posture is another helpful exercise. This is a physical pose that involves standing tall, placing your hands on your hips, and lifting your chin as if you're on top of the world. It sounds silly, but research shows that standing like this for 20 seconds increases confidence. A third tip for decreasing stress is to be of the mindset that interviews are a two-way street. Remembering that you are there to evaluate the school just as much as they are there to evaluate you can be really helpful in decreasing the pressure. Planning ahead and practicing are very helpful as well. This will involve taking all of the steps I mentioned before your interview, practicing the common types of interview questions, and utilizing the general suggestions I will mention on the following slides. First, check your internet presence. Run your name through various search engines and review your social media content. If you see something you wouldn't want the school to see, you should make efforts to remove it. Second, plan a professional outfit. It's always better to dress more professionally and conservatively than not. Both men and women should make a neat and clean appearance and wear a pressed business suit of some sort. Women should not wear anything with a low neckline, and all skirts and dresses should be knee-length. Men should wear a tie and polish their shoes. Third, turn off your phone. Make sure it is off and out of sight throughout the entire day. And fourth, arrive 10 to 15 minutes early. This will make a good impression and give you a chance to settle in and collect your thoughts. It's important that you use positive nonverbal communication during your interview as well. That means having a firm handshake, making eye contact, and sitting up straight. We communicate so much through our body language, so try to be aware of your nonverbals throughout the day. Also, keep in mind that it's okay to take a few seconds to think before responding to questions. This will help you maintain your composure and ensure that you're giving the best possible responses in the moment. It's also essential that you come prepared to ask thoughtful questions at the conclusion of the interview. Jot down a list while you're reviewing the program website, as well as during the information session and school tour. And then, before you leave, ask the interviewer for her or his business card, so you can email a thank you note within 48 hours of your interview. This demonstrates that you are serious and enthusiastic about attending that school. Interviewers say that thank you emails make a difference, but not many students send one. So if you do, it will really make you stand out from the crowd. That concludes my presentation on preparing for medical and dental school interviews. For further information and help from the Center for Career and Professional Development, schedule a mock interview with our pre-professional counselor, utilize the information on the Pre-Health Advising course site, and review the interviewing resources on Handshake. Thanks for listening.